entering the room and washing my hands for 30 seconds. Washing your hands is the best way to help prevent the spread of any kind of bacteria and viruses that can cause disease. At this time, I will be putting on my gloves. Hi, my name is Genesis. I am a registered nurse. I will be performing a physical assessment on you. This assessment will take anywhere from 18 to 24 minutes to complete. All shared information will be remain confidential. Is that okay?
Okay.
Okay, perfect. I will be checking your vital signs at this time. Put the blood pressure cuff on her. Pulse ox on the finger. And temperature. All right. Her blood pressure is 120/80. Her heart rate is 62. Respirations is 16. And her SpO2 is 100 on room air. Temperature is 98.0. All vital signs are within normal limits at this time. All right, so I'm gonna start my physical assessment. Can you please tell me your name and your date of birth?
My name is Maria. 24 June 1974.
Okay, do you know what month and year it is right now?
12, 20, 22
And where are we right now?
in the clinic.
And why are you here today?
Physical
Assessment.
Physical assessment.
Okay, my patient is awake, alert, and oriented ×4. Facial expression is relaxed. Speech is clear and fluent. Affect is appropriate, and her mood is normal. Are you hurting anywhere, Maria?
No.
Okay, wonderful. I'm gonna go ahead and look at your head and your scalp. Her skull is symmetrical, normal cephalic. Her scalp is pink and intact. Her color of the hair is evenly distributed. Her texture of her hair is straight and dry, and there is no parasites found. Next, what I will be doing is assessing your facial features, your eyes, ears, nose, and your throat. Her facial features are symmetrical. Her eyes are upper third of the face, the nose is midline, and the mouth is on the lower thirds of her face. So all of that is normal. I'm going to be looking at your eyes by using my ophthalmoscope. My ophthalmoscope is going to help me assess the size of her eyes, the color, the cup-dis ratio, the margins, and any kind of new vessels or hemorrhages or anything found in the eye. Okay, with my 2 index fingers, I am going to hold your under eye here, and I'm going to have you just look up. I'm going to look at your sclera and your conjunctiva. All right, you're going to feel me touch. Go ahead and look up. Perfect. Her eyelids are symmetrical. Her sclera is white and shiny, and her conjunctiva is pink. All right. This time I'm going to go ahead and dim the lights. And what I will have you look is I'm just going to have you look straight ahead. And with my pen light, I'm going to check the reactivity of your lights. So just look straight ahead. Perfect. I'm going to turn the lights back on. What I'm going to have you do is just keep your head straight and stare off into the distance. And with your eyes, I'm just going to have you follow my pen light. Try not to move your head too much. Just keep your head nice and straight. Okay, pupils are equal, round, and reactive to light and accommodate. I will be now assessing your ears using my otoscope. This otoscope is going to help me assess the ear canal, the tympanic membrane, and then the middle of the ear as well. Okay, you're going to feel me touch your ear. Pinna is up, and then I'm going to pull back. Tympanic membrane is clear, gray, and shiny. I'm gonna feel her ears now. Any tenderness?
No.
Okay, great. Ears are symmetrical. The tip of the ear is at the same level as the palpebral fascia. The skin is warm and intact and uniform in color. There is no drainage or lesions. The patient denies any tenderness or pain on the auricle, targus, and mastoid process of the ear. What I now will be doing is assessing your nose. For this assessment, I'm going to have you do is with one finger, any finger doesn't matter. I'm going to have you cover one nostril, breathe in, and then we're going to do the same thing with the other one, okay? Okay. Perfect. All right, one more time. Okay, perfect. You did a great job. Any difficulties with that?
No.
Okay, with my pen light, I'm gonna look inside your nose, so chin up, please. Okay, you can go ahead and relax. Her nose is midline on the face without any kind of deviations. Cranial one is intact bilaterally. Now I'm gonna palpate your frontal and maxilloid process for any sinuses, for any kind of tenderness. Any tenderness, Maria?
No.
Wonderful. Moving right along, I'm going to be looking at your mouth and your lips. With my same pen light, I'm going to have you open. I'm going to look at your palate. Relax your tongue. Under your tongue. Stick out your tongue. Say ah. Wonderful. Her uvula is midline and rises and falls. Her tongue is pink and moist and midline as well. Her ventral surfaces are smooth, saliva is present. Her palate is smooth, no lesions found in her mouth. Her palate is white and transverse, and her tonsils were present. Pink, no swelling, grade 4. Okay, I'm gonna look at your lips at this time. Her lips are pink and moist without any kind of lesions. They are symmetrical. Her buccal mucosa is uniform and pink. Her teeth are present and white with no kind of appliances or devices. Now I'm going to look at her neck. Okay, you are going to feel me touch for this assessment. I'm going to palpate your lymph nodes. Prearticular, posterior articular, occipital jugular digastric, submandibular, submental, superficial cervical chain, posterior cervical chain, deep cervical chain, and supraclavicular. Any tenderness?
No.
All right. Now I am going to feel your carotid pulses one at a time. Her carotid pulses are strong bilaterally, +2, equal. Now I am going to take a listen for this exam. I'm going to have you breathe in and breathe out, and then you're going to hold your breath, okay? Breathe in, breathe out, and hold. Breathe in, breathe out, and hold. Wonderful. Her carotid pulses are regular rhythm and no bruit. Next, I'm going to go ahead and just listen to your heart. To find the aortic, I'm going to go second intercostal space, and I'm going to go right to get to the pulmonic. We're going to go back to the second and left sternal border. Erg's point is third intercostal space, left sternal border. Tricuspid is fifth intercostal space, left sternal border. Her mitral is fifth intercostal and midclavicular. This is where I'm going to listen to her apical pulse for a full minute. Okay, her apical pulse is 62. Now with the bell, my stethoscope, I'm going to listen and I'm going to repeat to everything one more time. Just relax. Her heart rhythm is regular, no extra sounds or murmurs were heard on auscultation. Now, I'm going to be looking at your chest and I'm also going to listen to your lungs. I'm going to check the turgor under her clavicle. Skin turgor on the chest is normal. I will be looking at her anterior and posterior transverse diameter. Her transverse diameter is 1 to 2. Her spine is midline and S-shaped. I'm going to go ahead and palpate everywhere. No lumps felt. Any tenderness, Maria?
No.
No tenderness or pain. All right. I'm going to go ahead and listen to your lungs, okay? And just breathe in and breathe out normally. Good job. Perfect. All right, I'm going to go ahead and turn you. I'm going to listen to your backside. Her vesicular sounds are present, anterior and posterior. Her lung sounds are clear bilaterally, posterior and anteriorly as well. Now I'm going to do a peripheral vascular exam. For this exam, I'm going to just be looking at your arms, your hands, your feet. I'm going to be looking at the skin, skin temperature, and all of that kind of stuff. I'm going to go ahead and start with your hands. I'm going to feel your radial pulses, +2 bilaterally. I'm going to feel your brachial pulses. Brachial pulses are +2 bilaterally, which is normal as well. Her skin is warm, pink, and intact. No lesions found on the skin. I'm going to see the back of your hands. I'm just going to feel the temperature. And then go ahead and hands back up. Okay. I'm going to look at your nails. Nails are convexed, trimmed, translucent, no clubbing. Her cap refill is less than 3 seconds bilaterally. Skin turgor was normal. I'm going to look at your feet and your legs. I'm going to palpate your posterior tibial pulses, +2 bilaterally. Now I'm going to palpate your dorsalis pedis, +2 bilaterally as well. I'm going to look at the skin on your legs and check for any kind of edema. You're going to feel me touch and press down. Okay, no edema present on the lower extremities. I'm going to look at your toes now. Okay. My patient has no clubbing on the toenails. Cap refill on the toes is less than 2 seconds. The color of her lower extremities matches the rest of her body. She is uniform. My patient has no tattoos or anything like that. The nails are convex and translucent. We're almost done. Next, what I'm going to do is I'm going to look at your abdomen area. This assessment, I'm going to have usually my patient lying down, but we're just going to pretend she's lying down. Are you having any kind of pain on your abdomen or your stomach?
No.
Okay. When was your last bowel movement?
Yesterday.
Okay. I'm going to go ahead and take a listen to your abdomen, starting on the right side. Okay. All 4 vowel sounds are present on auscultation. They are active. Now what I'm going to do, Maria, is I'm going to palpate your stomach, okay, or your abdomen area. Any tenderness while I'm doing this?
No.
Okay, I'm going to press down just a little more, okay, a little deeper. Any pain?
No.
Okay, wonderful. While I'm assessing her abdomen area, I'm also going to be looking at the skin on her abdomen area. Okay. Her skin is warm and intact. It matches the rest of her body. There are no rashes, stretch marks, or lesions, bulges, anything like that. Her umbilicus is midline. Now what I'm going to do is I'm going to name the major organs of the abdomen area. Starting with the right lower quadrant, we have her appendix, her part of the large intestine, the right ureter, her right upper quadrant. We have a part of the liver, the pancreas, the stomach, and then the right kidney. On the left side, upper quadrant, we have her left kidney, the spleen, and the small intestine. And then lastly, on the right lower quadrant, we have the left ureter, the small intestine, and then the sigmoid colon as well. All right, well that completes the physical assessment. Do you have any questions for me today, Maria?
No.
All right, thank you so much.